Continuing education knows that at the end, students want to graduate, and we can help them do that because we take the time to really listen to their needs, and we understand all the different options that are available across the campus for them.
We don't take a cookie cutter approach. We realize each student comes with their own story. So whether it's a part-time student looking to complete a degree program or someone just looking for online courses, we're there to connect them to the resources of the university.
Welcome everybody, I am Jonathan Singer. Today is April 10th, it is 12 p.m. and this is panel number 18045, Psychedelics, Science, Therapy, and Policy. So if you're here for something else, please stay because it's going to be quite the ride. I'm Jonathan Singer, your moderator here. I also work as the Senior Director of Policy Programs at the Boulder Chamber of Commerce and have a former life as a lawmaker. So I spent 8 years working on the cannabis legalization regime, but came through it honestly as a caseworker working in the world of case management for kids at risk, as well as people struggling with substance use. So today we've got a phenomenal panel here, and we're going to be joined by folks who are experts in everything from rats to politics, is what I've been told. So in addition, I want to thank Carrie, Nate, Scott, and Taylor all for being here today. Hopefully I got you in directional order there as close as possible. But we're going to hear from folks with a wealth of knowledge. Carrie comes to us to really speak from an expertise in the world of policy as it's happening right now. Nate comes by this just as honestly, starting out in the world of philosophy and politics, policy, and moving into the world of mindfulness, and as that relates to this issue. And then Scott down there, well, while he may be an expert in the world of rats, he also goes far beyond just our small primates to these larger primates that we all talk about here today. And Taylor has been working in the rulemaking arena here as it relates to the new regime in psychedelics here in the state of Colorado, doing groundbreaking work. But before I wax too poetic, I'm going to let each of our speakers introduce themselves a little bit and tell us why they're here today and what they hope to share with the group. In the meantime, for those of you who do have questions, please raise your hand. We'll have note cards going around, and we will always prioritize students, but that doesn't mean questions from the audience aren't welcome, so please let us know what your thoughts are, but write them on some note cards, and I'll make sure to get as many of those out as we have this robust discussion today. With that, Carrie, take it away.
Hi, so actually I'm not going to be talking about policy at all. Just wanted to clarify that.
Thank you.
So it wasn't a surprise to anyone. I'm kind of just going to give a little brief overview and talk more about the, just to start off, right, psychedelic-assisted therapy and clinical research is not a new topic. There is actually a history with a lot of research that was conducted back in the 50s and 60s. It just wasn't up to the standards as modern times, but findings that were generated from that really did find a supporting role for psychedelics as an adjunct to therapy for a variety of disorders. Unfortunately, in the 1970s, due to sort of like rampant psychedelic use, as well as the growing concerns of the methodological flaws that were within that research, and then finally with federal regulations put in place which basically restricted psychedelic use, that all kind of ended. But in the past 2 decades, there's been a lot of renewed research and interest in psychedelics as a tool in therapy, and we've kind of been able to address to some degree the flaws that were there in the 50s and 60s with a lot of randomized clinical trials that include placebo-controlled conditions as comparisons, and the findings from that have been really, really promising. So essentially, like, for depression, anxiety, substance use, et cetera, there's just been these like really interesting and robust reductions in that can be pretty quick acting, actually, in some cases, as quick as a couple of days or a couple of hours to a day after administration. So that's really remarkable. And then equally remarkable are the sort of enduring effects that have been seen for this too, as long out as 4.5 years from the administration, there have been continued reductions in things like depression and anxiety. So yeah, again, really, really promising work, but that's not to say, obviously, that that's definitive or conclusive, right? More research has to be done, and I think one thing that's really important to continue to investigate it are sort of the mechanisms. Why are psychedelics coming out with these, or what is the reason for these potential therapeutic benefits? One thing that gets talked about, right, in the psychological aspect is that these psychedelics can really alter the state of consciousness to the point that it provides this unique opportunity for patients to really self-reflect and be aware of these problematic thoughts and patterns that they're engaging in that might be underlying some of these symptoms of the disorder, and so to really be able to address and overcome that. I think a couple other important things to note too in terms of the therapeutic context are, and I guess this goes into policy a little bit, but the cost effectiveness of this treatment. So one thing to note for psychedelic assisted therapy is that when the administration happens, during that session, there's somebody that's going to be there monitoring the patient for the duration of their trip, which can be as long as 8 hours. So that's time, right, from the patient's day, from the therapist's day, and time is money. And so that may not be feasible for everyone to be able to participate. And we just want to make sure that like anyone that can get access, that needs that help, will be able to that they'll be able to utilize that. So just something to consider moving forward. So I guess just to wrap up, more research needs to be done, but there is a lot of support to show that psychedelics can be very useful in the therapeutic context, and I think we have every reason to be hopeful about this moving forward. Thank you.
All right, so before we move to Nate, and actually this is apropos of this topic as well, as we talk about the legalization and the science behind psychedelics, there's also a huge component as it relates to our indigenous populations. And so before we continue, the University of Colorado Boulder, Colorado's flagship university, honors and recognizes the many contributions of indigenous peoples in our state. And CU Boulder acknowledges that it is located on the traditional territories and ancestral homelands of the Cheyenne, Arapaho, and Ute, and other Native American nations. Their forced removal from these territories has caused devastating and lasting impacts. While the University of Colorado Boulder could never undo or rectify the devastation wrought on indigenous peoples, we commit to improving and enhancing engagement with indigenous peoples and issues locally and globally. We will do this by recognizing and amplifying the voices of Indigenous CU Boulder students, staff, and faculty and their work, educating and conducting research, supporting student success and integrating Indigenous knowledge, consulting, engaging, and working collaboratively with tribal nations to enhance our ability to provide access and culturally sensitive support to recruit, retain, and graduate Native American students in a climate that is inclusive and respectful. So I was remiss in not mentioning that before, but certainly apropos of our conversation today. Nate, I'm going to kick it over to you to talk a little bit more about your perspectives on this.
Okay, thank you, Jonathan. Thank you, everybody, for coming. If you had told me several years ago that I would be sitting on a panel talking about psychedelics, I would have told you you were crazy. And the reason for that is my research, well, I used to be a political philosopher, and then more recently writing primarily around mindfulness. What got me into this whole topic was working on a book about the distinction between an open and closed mind, particularly in our current era where there's so much momentum of closure in the form of screen addiction, political polarization. And as I looked at the tools for cultivating a more open mind, obviously there are things like meditation, but given the rise of psychedelic science, I realized I had to have something to say about psychedelics. So I decided both to go into the rabbit hole of research, particularly on ketamine, but also to go into the rabbit hole of 2 years of psychedelic-assisted therapy with myself as the client. And as a result of that, I think the best way to describe my current perspective is using a phrase from the 20th century theologian Reinhold Niebuhr, who liked to say he was a pessimistic optimist. So I want to talk about why I feel incredibly pessimistic and why I feel incredibly optimistic. pessimism. First thing, I have found that in these discussions, it's very unclear the line between psychedelics as a consciousness expanding, mind expanding set of compounds and psychedelics as just yet another way to escape from the suffering that we experience in modern life. You know, the line between therapeutic and these drugs just being similar to something like alcohol or marijuana. So that's point one. Point two is there's been the rise of what I would call a kind of attitude of psychedelic exceptionalism, this idea that people who do psychedelics have this unique access to insights about the human mind and the universe that nobody else has, and the only way to get these insights is through taking these compounds. And of course, if we look at history, I think that's clearly false. There are all sorts of amazing insights that come from people who have never touched this stuff. And then finally, in these discussions, I found that there's often kind of like an avoidance of the topic of risk. And I don't know about you, but I have many family members, many friends who've experienced catastrophically bad effects from psychedelic compounds in their life. So I think we really do need to just acknowledge that these are extremely high risk compounds that we're dealing with. So that's why I think we should be pessimistic. Why should we be optimistic? Well, one thing that leads me to be optimistic is this distinction that I think is really essential between psychedelics, the compounds themselves, things like LSD, psilocybin, and psychedelic-assisted therapy, the pairing of these compounds with a skilled guide and an intentional structure of support. And it turns out that the research tells us when we shift from psychedelics as pure compounds used recreationally to something more like psychedelic-assisted therapy, we can really mitigate many of the risks associated with these compounds. Perhaps not all of the risk, but much of the risk can be mitigated. The second reason that I think we should be optimistic comes both from my own exploration of the science, but primarily from my exploration of psychedelic-assisted therapy itself, which is I think that there's a unique opportunity here for those of us who have experienced trauma to open to what I would think of as like the unopenable spaces of the mind. That there are some parts of the human psyche for many of us that are so raw, so vulnerable, so traumatized even, that there's just really no way to get there in ordinary consciousness. And psychedelic-assisted therapy may give us a way, for many of us, of going to these places and re-experiencing them in a new and different way. The metaphor that I really like to use here comes from Robin Carhart Harris. He was speaking at the MAPS conference last summer in Denver, and he talked about it like your ordinary consciousness is kind of like a mountaintop in the middle of summer where there's sheer rocks and cliffs, and it's almost impossible to navigate the terrain. But if you think about that same mountaintop in winter, after 2 months of snow, if you can picture that in your mind, everything is softer, everything is smoother, and all of a sudden there are new ways of traversing that terrain that wouldn't have been possible before. And I think that's the potential of psychedelic-assisted therapy, is to transform the mind into a space like that where we really actually can navigate some of these darker places. So that's basically the perspective I want to lay out for our discussion. Yes, we should be excited, but I think we should also acknowledge the complexity and proceed with great care and caution.
And speaking of great care and caution, it's interesting. We just discovered that we're essentially high school rivals, and so
yes.
I'm glad.
1997 Fairview, 1997 Boulder High.
So, and believe it or not, though, before you got your doctorate at Princeton, I know you were also at Stanford, and our next speaker also hails from Stanford at one point in time as well, but Dr. Scott Thompson. And so thank you for joining us and bringing in the psychiatric perspective now with your work at the University of Colorado School of Medicine.
Thank you. So I am Scott Thompson. I am a PhD neuroscientist and a professor of psychiatry at the University of Colorado School of Medicine on the Anschutz Medical Campus. I have sort of 3 jobs there, and I'm more than happy to discuss any of them with you. First of all, and primarily, I am a mouse psychiatrist. And so I'm happy to say that we are doing a very good job of curing mice, so that's the good news. And we have ways of studying models of mouse behavior that shed light on how these powerful compounds work on the human brain, we'd like to think. And so we are working very hard to understand the mechanisms of action of these compounds. Why do they make people better? And they surely do. And so to follow up Nate's analogy with a little biology, what happens under the influence of psychedelics, it seems, is that your brain is slightly more plastic. And so that's kind of a vague term, and I think that's a little bit deliberate because we don't have the details, but basically every time you learn something, your brain is exhibiting plasticity. If you meet somebody today before the session starts, remember their name, your brain has displayed a small amount of plasticity. And there's something about the action of psychedelics that makes that plasticity process more easily accessible, more plastic. And so when you confront the obstacles that you may have in your life under a condition of heightened plasticity, it gives you the ability to rethink the way you face those problems internally. That is the closest as I can come to a biological explanation of the magic of psychedelics in assisting with psychiatric disease. And so these are things we can study in mice. We need to know how these drugs work, and the reason we need to know that is because there are hundreds and hundreds of psychedelic compounds, not just the ones that you may be familiar with. Some very good bathtub chemists in the 1960s synthesized hundreds of analogs of the ones that you know the names of, and we need to know which ones are best to go forward with into the clinic, into practice. Maybe psilocybin isn't the optimal one. It's certainly very good, but maybe there are better ones. We need to have, for example, ones that have a shorter acting duration, perhaps, because the 8 hours of psychedelic-assisted therapy as we practice it now is beyond the means of many people. They can't afford to take a day off from work. They can't afford to come in for the prep session and the integration session afterwards. And so if we want to increase access and equitability in the way we practice psychedelic-assisted medicine, we need to explore other possibilities. And so I also have I wear a hat for the Department of Psychiatry, which is the director of Center for Novel Therapeutics, and so we are working very hard to explore this pharmacological space. We are about to launch our first trial at Anschutz for psilocybin in treating major depressive disorder, and that's very exciting for me as a mouse guy to finally think that I can do well for people as well as mice. And then I also wear a hat that is loosely centered on the Anschutz campus, which is something we call the Psychedelic Public Policy Partnership. This is a cabal of about 100 people with an interest in psychedelics, and we have affiliated ourselves to help the state now as it begins to formulate the policies that are necessary for enacting the Natural Medicines Act that we all approved back in November of 2022. And so for the last 2 years, the state's been heavily engaged in the rulemaking process. They established committees to advise them. Committees established listening sessions where people can come in and talk to them. And so we have been trying to bring the voice of medicine and biology to that conversation. There are a lot of things that we've had some success on so far. So the regulations for who should be a licensed therapist. For some people, a minimal amount of training and a great deal of hands-on experience is probably sufficient. But for some conditions, a greater amount of training is necessary, PTSD in particular. If you are not experienced with treating PTSD, you can do lasting harm to people. So we need to make sure that there are different tiers, and I think the state has agreed to this licensing paradigm where depending on the condition of people coming in, maybe more training is needed for facilitators. We suggested 10 hours of clinical practice. There was a pushback against that, and we noted that it takes 140 hours of clinical practice to be a hairdresser. And so I think 10 hours to mess with somebody's mind is probably quite acceptable. The other thing that we're interested in is the safety guardrail. So as Nate mentioned, Psychedelics might not be for everybody. I was part of a panel which had the catchy name of Ask Your Doctor if Psilocybin is right for you. And in fact, it was a humor thing at the beginning, but it's absolutely true. There are people that we are quite confident should not be taking psychedelic substances. If you have a family risk of schizophrenia, bipolar disorder, or some other psychotic disorders, the use of psychedelics is very strongly discouraged. And so with the opening up of the Natural Medicines Act, we need to make sure that there are guardrails in place that community physicians know how to advise people that are thinking of entering into the psychedelic medicine pathway, and that facilitators know the questions to ask before they begin treating people. And lastly, we're about to launch this experiment on the citizens of Colorado. This is going to produce many, many more patients who've experienced psychedelic medicine than all of the academic trials that have been done to date. And so we need to learn from this experience. We are working on procedures and methods for learning from the users how their experience went, how the effect was, did it last, how long did it last. This is the way that we can bring back to the state evidence of efficacy. We can convince maybe the healthcare payers that this is a cost-effective way to treat mental illness, which we all up here, I guess, believe it is. But we need numbers, and the best way to do that is to collect the experience of Coloradans as they go through this process. So I'm happy to discuss any of that as we go forward.
All right, and as somebody who is acutely aware of what our Department of regulatory agencies does as it regulates professions, I can certainly say, as somebody with my haircut, that maybe we should take more time to talk to our hairdressers and require a number of hours. But that may be more biology than it is practice on that. So with that being said, we're going to move to our last panelist here today. This is Taylor West, who's worked for decades in the political arena, but also co-created and serves as the project director for the UC Berkeley Psychedelics Survey. So Taylor, bring in your perspective on all this, wrap this back in, and once again, don't forget, if you do have questions, raise your hand, and we've got plenty more 3x5 cards to go around.
Thank you, Jonathan. Yeah, I think I'm here really to talk a little bit about the political theory around how we're starting to make changes to policy around psychedelics in the U.S. I actually came to this issue kind of from the political direction. Many people who are involved in psychedelics and psychedelic policy come to it through either their own personal experience of a real moment of healing or a real beneficial experience, or they see a friend or family member go through something similar. I actually came to it because I saw a remarkable political moment that I hadn't seen in quite some time. As Jonathan mentioned, I come from a background working in politics on campaigns primarily, and sort of shifted out of that over the last decade, in part because of how frustrating it was to see just how rigid people had become and really dug in on their positions. It's very difficult to change anyone's mind at this point on most political issues. I had the opportunity to be tangentially involved in Oregon when, back in 2020, you may know, there was a ballot initiative in Oregon to create a regulated psilocybin therapy program in the state, the first of its kind in the world, really. And I had the opportunity to sit in on some focus groups when we were talking to Oregon voters about this issue and beginning to understand where they come from. And this also ties into the psychedelic survey that Jonathan mentioned that I worked on with UC Berkeley. Public opinion around this topic is fascinating. And what we discovered in this focus group is that people, while they did not have a lot of information about psychedelics, they didn't have a lot of preconceived notions in the same way that actually they did when it came to cannabis. They were very open to having their minds changed or evolved when given information about what was possible with psychedelic-assisted therapy. We talked with people about the mental health crisis, and it was such a place of common ground for people, this concern that we have a crisis globally around mental health and that the tools that we have are just not sufficient to meet the challenge. And then we talked with them about the research that has been referenced here around the effectiveness of psychedelic-assisted therapy on some of the most common mental health challenges that we deal with: depression, anxiety, trauma. And when we were able to talk with them about the legitimate research that has been done at well-known institutions that show that this has the potential to help some people who are not being helped by our current tools, that immediately began to soften the ground for people to be interested in this concept. The next piece of that messaging that proved to be extremely important is talking about the guardrails. And it is very important that in all of our conversations around this, we do need to acknowledge that these are incredibly powerful medicines, and particularly at the dosings that we're talking about for a therapeutic effect. We can't go into this pretending like this doesn't have a profound effect. That is the whole point of psychedelic-assisted therapy. And so we also need to acknowledge that in the policies that we're building around these compounds. So those sort of three pieces, talking about the mental health crisis, talking about this as a potential new tool in our box, and talking about the ways that we are going to move policy that includes some of these guardrails, the training, the licensing, the regulations around how this psychedelic-assisted therapy is provided, those things really opened people's willingness to consider voting yes on an initiative like this. Watching people genuinely change their minds in the room was something I hadn't seen in a long time. And it made me really excited to actually step back into doing some political work that I hadn't done in a while. So I served as an advisor on that Oregon campaign. It was successful. And then we started to look at where might we be able to continue to expand this opportunity for policy reform. I live in Denver, and certainly Colorado, as I'm sure you are aware, has a history of drug policy reform through ballot initiative. It's also a state that has a ballot initiative process that is more accessible than some places. And so it felt like a natural fit for where we might start to look at expanding this policy reform. So I ended up helping to lead the initiative here in Colorado, Proposition 122. If you live here in Colorado, you were able to vote on that on the November 2022 ballot. It did pass by a fairly significant margin, 56%, something like that, 56 or 57. And it was because we were able to talk about all of those message points that I discussed. I think moving forward, and I'll make this kind of my last piece because I know we've got a lot to talk about here, ballot initiatives are a really interesting political strategy for this kind of policy. When it comes to psychedelic policy, much as it was with cannabis policy, our elected leaders tend to be the most risk-averse of our society around things related to drugs. I think there has been an extensive conversation in recent years around the failures of prohibition, the failures of the war on drugs, and I think the general population has actually been absorbing that conversation a lot more effectively than, frankly, a lot of our elected leaders have. So when you do a ballot initiative, you can take these questions directly to voters instead of having to work through kind of the fear of a legislator who's worried about backlash on a vote. Ballot initiatives also allow you to write the policy much more in a much more detailed way than going through a legislative process. So those are ways that you can really have some control over what happens. The downside to ballot initiatives is they are unbelievably expensive to run, really unfairly prohibitive when it comes down to it. And I think we saw cannabis policy move almost exclusively by ballot initiative for quite some time before legislatures were willing to start thinking about making changes in their own states. What we're seeing with psychedelic policy is that things seem to be moving more quickly. I think we've seen success with the ballot initiatives in Oregon and Colorado. There's going to be an initiative on the ballot in Massachusetts this fall. Those are, good sort of first signals. But we're also seeing something like 30 states have had legislative efforts around some aspect of psychedelics, whether it's study committees, funding research, looking at creating regulated programs like we're building here in Colorado. That's happening much more quickly than we saw with cannabis. The idea of accepting that there might be a productive way to provide access to psychedelic-assisted therapy seems to have caught on much more quickly. I think that's partly because the research is more extensive, and I also think, frankly, that cannabis legalization helped open up a conversation around the idea that maybe blanket prohibition is not the right way to handle our approach to drugs. So I'm happy to talk more about kind of the political process moving forward. I also have lots of thoughts about what's happening in Colorado and how these policies can be designed in the best ways. But I will stop there and let us move on to the discussion.
Well, no, before we, and thank you, all four of you, for being here. You know, we've got a few questions already on the board. We've got about 30 minutes to go. And so before we go into the questions, though, I want to do some level setting on a couple of things, because, you know, we are already using terms that either our viewing audience from home or even our audience here may or may not be familiar with. And so I wanted to start with a very easy one, and thankfully we've got, you know, a PhD psychologist here and a PhD in neurobiology. What is a psychedelic? We hear, you know, we talk about cannabis, we talk about alcohol. There's a fentanyl crisis that's, you know, moved on down to xylazine and other things. Whether, you know, from Taylor's perspective of how do you communicate to the voters, we want to make sure we have an informed electorate. So when we're having that informed electorate, you know, Carrie, you know, Scott, you know, tell us, what is a psychedelic? Let's start there.
Well, actually, I think probably you know way more about this, because neurobiologically, I think it has a lot to do with, that's how it gets classified. So,
Yeah, so to biologists and pharmacologists, the classic psychedelics are things that produce the trip that we all may know, experience. They do that by activating a particular receptor for an endogenous neurohormone called serotonin. And so to biologists and pharmacologists, a psychedelic is a substance that produces strong activation of the 5-HT2A receptor. Got that? Ketamine has very potent effects on your perception of the world. And so in that sense, it's like a psychedelic. It is not acting by serotonin receptors. And if you get down into the weeds of the perceptual alterations, ketamine is technically called a dissociative. It gives you, I'm going to call it an out-of-a-body experience for lack of a better way to describe it, which is not qualitatively like the psychedelic experience. So the psychedelics classically, LSD, psilocybin, mescaline, ibogaine, ayahuasca, you may hear these days as well. What the voters passed is, for the moment, just psilocybin, but in 2026 we should also have a compound called DMT, and ibogaine and mescaline as well.
All right, everyone got that? All right.
Just one addition to that, MDMA
Absolutely.
would also not be a classical
That's right.
psychedelic.
That's right. It is called an entheogen because it produces this empathetic response.
So easy stuff here, right? No, in all senses of it, I wanted to do that level setting because there is the pharmacological terminology. Carrie, did we miss anything, or?
yeah, I was gonna, I mean, the serotonin receptor part was, I'm less familiar with, but I was like, that's how I've been conceptualizing like the classic hallucinogens.
So and so I'm going to bounce to Nate and Taylor here. Any other thoughts on that level setting? Because I know what we define pharmacologically may not be what we define politically or even socially necessarily. And so any thoughts on that one, Nate or Taylor?
I would just say, yeah, Scott is absolutely right. The classical psychedelics fall in that bucket. There's a more expansive definition out there. MAPS defines psychedelic experience more expansively as including some other compounds. Stanislav Groth at one point defined psychedelics as non-specific amplifiers. So if you go that far, all of a sudden breath work can be a psychedelic, music can be a psychedelic. So I don't know where we should draw the lines, but I just want people to be aware that there are different definitions and there is a kind of debate culturally out there about what we count.
Yeah, no, and Taylor, you're nodding knowingly, but if you have any additions to that, let's here.
Well, this is sort of a related topic, but I think it's important for level setting too, when we're talking about the sort of policy and political angle. You may know, as it's been referenced a few times, that MDMA is currently late in the process of going through FDA approval for the treatment of PTSD. It's an extremely arduous process. MAPS is the Multidisciplinary Association for
Psychedelics.
Shoot, I'm forgetting I'm forgetting the last two. But anyway, they have been, frankly, working for MDMA's FDA approval for practically the last 30 years. We are close to the finish line there, but it has also cost at least $100 million at this point, and will likely be more before it's over. And I say this because I think it's important to recognize that there are some people who question why we would do an initiative like Colorado's when you could, in theory, put psilocybin and these other psychedelics through the FDA approval process and really, fold it into the medical system in a traditional way. There are lots of different reasons for why people choose to support a more state policy level route, but one of them is certainly the amount of time it takes and the amount of money it takes, and frankly the fact that our sort of drug approval process in this country is somewhat broken. And so I want to say that in conjunction with this sort of level setting, that there is the FDA approval route, and the process that I was talking about when it comes to sort of the political work is really about exploring ways to create access that doesn't require the arduousness, frankly, of going through that process.
So a lot of questions here about benefits and dangers. A lot of questions about benefits and dangers. And so, and by the way, most folks here have not sort of directed this to any specific speaker, and so I'm going to do my best to try and direct it, but also if other people have thoughts on it, let's entertain those as well. So and thank you all, by the way. I know we're trying to remember what MAPS stood for. I tell people I have ADD. It's acronym deficiency disorder. We should all do our best not to use acronyms in this room here, and in life. It's a great way to get people to tune out, actually, and we want people tuned in. So starting with an acronym, if a PAT session goes sideways, i.e. a bad trip, what does the therapist actually do in response? That's the question. I'm going to build on that just one step further and say, some of you are dealing with the regulatory component of this, some of you are dealing with the pharmacological component, or even the social component of this. So I'm gonna throw it. Scott, you sort of nodded really quickly on that one, so I'm gonna throw it to you, but then I'd like to hear some other responses from the panel on that one. So.
Yeah, I think Nate may have a lot to say about that too.
Yeah.
So, there are a couple things to say. First of all, the bad trip, right, that we all, have in our vernacular. What academic studies and I think underground clinical practice has shown is that if you prepare people for the experience and they come into it with the mindset of what they hope to get out of it, and they're in a setting where they feel safe and comfortable, and they're with a high quality product, that the risk of bad trips, so to speak, has gone down to very tolerable levels. Let's hope so. But then there's another experience that Nate may want to speak about, which is the challenging experience, right? If you are confronting something that's holding you back in life, it's difficult, it's hard work. Many of you have probably experienced this in your lives. And that's what we call, I think, the challenging trip, right? And the challenge for the guide is to know the difference between a bad trip and a challenging trip. Most people feel it's necessary to confront the challenging experience and get to the other side. But how do you know when somebody's under the influence? Should bad trips happen, there are medications that we can give. This is a little bit of a policy issue that we need to face. We need to help EMTs know what to do if they are called on a 911 call to a healing center with somebody who's having a bad trip. Do they have the medicines available to them that can stop the trip? But I haven't seen the state talking about that yet, but it's an important topic.
All right. Nate, other thoughts?
Yeah, I would just say there's really interesting research here on quote unquote bad trips, challenging trips. Roland Griffith's team did a survey of about 2,000 people on their worst experiences with psilocybin, and they found 40% of people rated their worst bad trip as one of the 5 worst, most challenging moments of their entire life. 11% of people said they put themselves or others in physical harm. 3% of people ended up needing medical attention. So this is out of 2,000 people. That's a pretty substantial portion of the people who are using psilocybin. Again, this is recreationally. But the really weird finding of this study is that somewhere around 80% of these people said that they actually benefited from the experience of having this bad trip. And I think that's really interesting because it gets to Scott's point that yes, there are bad trips and there are challenging trips, but sometimes those experiences are actually, in a paradoxical way, a sort of gateway to healing. Maybe it's uncomfortable, maybe it's really terrifying on some level, but there is that possibility that a bad trip is actually almost like a vehicle toward some sort of healing. And when you have a guide who can help you in the session, but also through the integration over time, meeting the day after, a couple days after, the weeks after, I think you can begin to mitigate the problematic consequences of a bad trip and begin to redescribe it as potentially a healing moment.
Carrie?
I was just gonna kind of reiterate what Scott is saying, like, and also actually what Nate was saying too, that like when you are in the sort of proper setting and you've been kind of given some preparation for it, I think those bad trips are usually pretty, they're not very likely. So like there was a systematic review and meta-analysis regarding some of these psychedelic-assisted therapies among, I think it was depression in particular, but essentially like the adverse events that happened, like the worst adverse event that was like the most common was like nausea and headaches. So, they didn't really I would imagine that's just very rare for this to occur when you've been given all of this prep and like you're with someone who, is helping to make sure that you're going to be safe during the duration of the trip.
So I'm going to do one more sort of on the more sort of ominous side, then we'll hopefully go to something a little bit more lighter and expansive. But I thought this is an important question here. What is the current danger in psychedelics in street drugs that may be mixed with other street drugs by current illegal drug salespeople? So and if none of you have a response on that, that's fine too. But
well, I will say just two different things I kind of would want to address here. One is that in Colorado, what has been both decriminalized and now is part of the regulated access program that is being developed with facilitators and licensing and all of that. Each of the compounds that is involved in that is a natural compound. They are things that can be grown. They are things that can be used without extensive processing. And so while that doesn't immediately protect you from sorry, I lost the word, from basically things being added in or having a... I'll keep moving. It does add a little bit of a less risk in terms of receiving something that has been adulterated. That was the word I was looking for the whole time. So when you're talking about a mushroom, for instance, if you are taking those in their natural form, you have a little bit more confidence that at least they have not been adulterated with something like fentanyl, which we know is now, infiltrating much of the drug supply throughout sort of the underground market. So that's one piece of it. I think also an important part of changing our policy around these compounds is to make it possible for people to access these medicines in a way that is transparent and accountable. And that is part of the licensing and regulation process for a program like the one we're installing in Colorado, is that the producers of these medicines will be subject to licensing and review and accountability in ways that you will never ever get in a system that operates underground.
Yeah, and we've got some political questions coming here too, but and I'll try not to interject myself too much as a moderator here, but one of the things, having formerly been a social worker, I work with the substance use advisor group here in Boulder County, which is an amalgamation of people who are living in recovery to law enforcement to medical experts. We are on the CU campus right now. Anecdotal reports from students right now is that you cannot find If you are currently using cocaine, you cannot find cocaine without fentanyl in it. So test your drugs. Public service announcements. Test your drugs.
Carry Narcan.
There are ways that you can do it. And, Taylor, thank you for bringing us back to sort of the political implications of this and why we may or may not want to legalize things. But just by virtue of a public service announcement, I'm going to turn it 20 degrees on its side. So when we talk about fentanyl, it's fatal, right? There are very fatal levels that any of us could be ingesting if we chose to ingest it. Psychedelics, we talk about LD50, right? Lethal dose, right? We hear about overdoses in opioids and in alcohol, other substances. Fatality element when it comes to psychedelics. What does that look like, and what should people know?
Do y'all know who Diane Linkletter is? Art Linkletter was a 60s beloved TV personality, super conservative, man of the earth, down folksy guy. His daughter was a 20-something person in California in 1968. She fell to her death off a balcony. Art Linkletter, who was vehemently opposed to drugs, blamed her death on LSD. She thought she could fly off the balcony. In fact, she was depressed and she committed suicide. Didn't stop Art. He couldn't admit that his daughter was depressed and committed suicide, and so Art mobilized the silent majority to convince the Nixon and Johnson administrations to launch the war on drugs, basically. And so there's a lot of bad things that can happen that don't really have anything to do with the drugs. And to me, that's a much greater risk. People have studied the relative risk of all kinds of substances of abuse, and psychedelics are near the bottom, far below alcohol, for example. And so the greater risk is somebody being intoxicated and doing something they shouldn't do.
So I'm going to jump to Carrie on that one for a second, actually, because we talked a little bit about polysubstance impairment and what that means. So polysubstance being, excuse me, that it's alcohol plus something, or opioids plus something, or psychedelics plus something. So where is the science going on this? There are obviously legal implications to this. If somebody is driving under the influence of alcohol, we know 0.08 is the legal limit, regardless of whether or not somebody is impaired at that level. We've decided as a community, as a society, that's the limit. We don't necessarily have limits for other substances right now. Tell us a little bit about what that looks like from your world, where we might want to look to move forward in that world.
Yeah, so I actually am not super familiar with the literature when it comes to psychedelics in particular, plus other substances, except for maybe in particular psilocybin and cannabis use. From what I do know of that, essentially any kind of polysubstance use is usually not a good thing, or it's associated with increased use of multiple substances. So, but looking at psilocybin and cannabis use, that does increase cannabis dependence, or at least there's an association with that. So there's a problem right there. And cannabis use per se is not necessarily a problem, but obviously dependence on anything is an issue. So that's something to be aware of and considerate of. Trying to think if I know anything else about psilocybin or psychedelics and any other substance.
Well, and it's an emerging field. I don't know if anyone has any other thoughts on this one. We can jump to another topic here, but it is something just to be conscious of and aware of, and the science is still forming around that. So.
Yeah, I think it would just be important to emphasize the point that Scott made, which is that from a chemical and toxicology standpoint, psychedelics are extremely low on the risk scale. They have an extremely low risk of addictive properties, in part because repeated use of them actually decreases their effectiveness as opposed to a lot of other drugs. And they also have a very low risk of toxicity in the same way that other drugs can actually cause, fentanyl or opioid use can actually literally kill you. That's not the case with these medications or these compounds. But what it really highlights is the importance of understanding that the risks are around the environment that you are consuming these compounds in. And that, I think, is going to be an important piece of public education from a harm reduction standpoint. We don't want people to put themselves in situations where they could cause harm to themselves or harm to others. And that's why it's very important for people to understand that it's not a good idea to do psychedelics. Whether you're in a regulated system or decriminalized or an illegal system, it's a bad idea to do them alone. It is a good idea to have someone who is in charge of taking care of everyone and making sure that the environment is safe. So I would encourage you, if this is a topic that you're interested in, or if, frankly, the use of psychedelics is something that you're interested in, educate yourself about the safe way to engage in that.
So
This is going to be important as the healing centers get up too, right? I mean, just because it has a Colorado approved healing center label on the door doesn't mean the facilitators there are necessarily trustworthy and well trained and know what they're doing. And so we need we need a Yelp basically for healing centers and facilitators, right? I mean, we need a way for people to report their experience. There have been a couple of well-characterized instances of abuse where the therapists have abused the trust of the participant while they're under the influence, and so there are a lot of guidelines and safety concerns for that as well.
Well, and in Colorado, this is unique, but for licensed professionals, there is a way that any of us can file a complaint, and any of us can look up, whether it's a therapist, a doctor, anyone that's licensed in Colorado. There are these opportunities. So let's maybe move from sort of the ominous cloud to some of the opportunities here. A lot of people asking about microdosing, what's happening in California, in Silicon Valley. It's become very popular, both for therapeutic purposes as well as recreational purposes. And so once again, with a little bit of level setting, I know I'm hip with the kids when I talk about microdosing, but why, if someone wants to tell us a little bit about what is microdosing, what are some of the benefits, and what should the general public know about this if they were to start looking towards accessing a healing center?
Well, the first thing that I think is really important for people to understand is that when we talk about the research that shows these sort of dramatic healing benefits of psychedelic therapy, we are not talking about microdosing. These are significant doses, significant experiences. This is not something you do and then just go move through your day. I don't want to say that microdosing doesn't have an impact. There are certainly a dramatic amount of anecdotal evidence around that. I will say the research so far has not held up those claims in the same way that they have around a more substantive dose taken in a therapeutic context with the purpose of healing. So I think microdosing, to the extent that you're curious about it, there's lots of information out there, and it's not a dangerous situation to work with. But I do think it's super important for people to understand that the kind of dramatic benefit that you're hearing about when it comes to psychedelic therapy is not analogous with microdosing.
And I was just going to add to that point is that I am actually unaware of any large, clinical trials that look at microdosing in particular when it comes to psychiatric disorders. I think that there is research on microdosing sort of like in an observational level when people answer surveys, and there's, I think, correlations with increased quality of life and things like that, but it is, that's generally a cross-sectional look, right? We're not doing experimental research with that, I think, currently. Something else that is interesting to think about with microdosing is not necessarily how does it help with psychiatric disorders or symptoms, but how could it maybe help with daily functioning? So interestingly, there's maybe I've been trying to look into this research myself, how does it have to do with health behavior? Does it increase physical activity? Does it increase better diet quality? There's not really a lot of research out there on that, but I think that's a really interesting field to be looking into as we move forward.
And Scott, and then Nate, I was going to go with you next. So
Go
Scott first, then.
Well, okay, so what the study showed is that people who were given microdoses or placebos, some people got better, some people didn't. It turns out that some of the people that got better got the placebo, Some of the people got the microdose. The thing that distinguished those people that got better from those that did not is what they thought they got. Everybody who thought they were microdosing got better. Everybody who thought they got the placebo did not get better. And so that is to make a point that the mind is a powerful thing. And the placebo effect is extremely real. If you believe that you're going to get better, there's a significant chance that you will. And so microdosing might be, you might say, harmless, right? So if you think you're going to get better and you do feel better, great. But we need to point out that if you're microdosing LSD, that is illegal here, even in Colorado, even in Denver. And so you're putting yourself under some legal risk. And if you remember fen-phen, a diet drug from the 90s maybe, was withdrawn from the market because it produced heart defects. Turns out that psychedelics activate the same receptors that fen-phen activated, and so there is some risk with chronic microdosing potentially for cardiovascular damage. So it is not entirely benign.
Yeah, I was going to say the same thing. The study where they did the placebo and the microdose and people couldn't tell the difference, I think that's really interesting. And I'll just add a phenomenological first-person perspective. I decided to be a human guinea pig on this myself and microdosed psilocybin for a couple months. And I would say that it was interesting, but I really did not notice any substantial changes in my overall well-being. And to Taylor's point, it was very different than a large dose psychedelic-assisted therapy session where there was a major disruption in my mind, and as a result, a downstream major benefit in my overall experience of life, my ability to deal with challenging emotions and things like that. So there is something about the bigger doses that seems to have a bigger effect, as one would imagine.
So, yeah, I've been microdosing placebos and it hasn't been working at all.
Maybe I was doing that too, I don't know.
So Nate, just to stick with you for just a second here, a lot of people have been asking about, what was the value in not just the therapeutic, but even recreational I'll use the questioners, the words here, mind expansion, creativity. What are some of the things that you're seeing that you've written about, discussed in other places that you think the general public should know a little bit more about, and also what your own human guinea pig experience is here? So
yeah, well, I'll just give you one story, which is, I think it was my second ketamine-assisted therapy session. I walked into that session. I was going to go on a flight 2 days after that session, which is not a neutral activity for me. I've had a fear of flying for about 20 years. So I go into the session, take the ketamine, put on the blinders. All of a sudden, the music kicks in, the drug kicks in, and I am on a plane. And I am flying all over the world, and it's exactly like a replica of a United flight going somewhere, except for one thing. None of the fear, none of the anxiety that has accompanied me for 20 years is there. In fact, it's like I'm in love with airplanes. Like I would live on this airplane if I could. And then the walls of the plane dissolve, and all of a sudden I'm in this like open compartment, and then everything gets kind of dark and ominous. The walls come back, and I witness myself, along with all the other passengers, dying in a plane crash. And I tell my therapist, "Oh my God, Sarah, it's a work of art. Plane crash is a work of art. It's all so beautiful." And I know that sounds like a crazy drug trip story because it is a crazy drug trip story. However, what happened after that was a pretty substantial shift in my experience of flying on an airplane. I would still feel some anxiety, but what would happen is I would experience that anxiety, and then instead of my mind going to these kind of doom loops of worst case scenario thinking, my mind would go to that moment. I called it on the ketamine express. So it was like a first person experience of the kind of neuroplasticity that Scott was talking about. So I would just put that out there as one experience. That was probably the most profound experience I had, and really life-changing in the sense that it allowed me to navigate this activity that I had a lot of trouble with for 20 years. in a way that no other protocol. I had been meditating intensely for 15 years, all sorts of things I had been doing. Nothing had that kind of impact until I did psychedelic-assisted therapy.
How much leg room did you have on that flight?
Infinite leg room.
That was not United you were on then. So,
As long as you're not the pilot.
Scott, yeah.
Yeah, so Picasso is sort of famous for saying, I could paint like Raphael as a child, and it took me my whole adult life to learn to paint like a child. When I think of the creativity enhancing part of psychedelics, I think of basically we are all inside still children somewhere, and somewhere in the course of life we got fenced in, boxed in, all our creativity, all our spontaneous thing. If you watch a small child singing a make-up song, dancing through your house, whatever, where is that in all of us, right? Where did it go? And I think we lost that sense of creativity, and it's still in us somewhere. And I think that psychedelics, through this opening of plasticity, removing of obstacles, has the ability to restore something that's innate in all of us.
I think that also leans into a point that I would make about why this would be another reason why going a route separate from the FDA route could be important for these compounds, because these are not just compounds that are for a sick person's specific condition. Certainly, FDA approval of MDMA for PTSD is a very specific set of, a condition and a therapy, and even that is going to be complicated coming through the FDA. But there is also quite a lot of research that looks into what people refer to as the betterment of well people. And I think you can almost think of it as preventive mental health care. I think when we think about physical therapy, for instance, there is physical therapy that can be prescribed for you to deal with a specific injury, recovery from a surgery, that is a very specific response to a medical need. There is also physical therapy that you could do ahead of, say, ski season, building up the muscles around your knees so that you are less likely to get injured in that process. And that, I think, is a good analogy for how we might think about what psychedelic-assisted therapy can do. It can be, for some people, an incredibly effective intervention for a specific issue, anxiety, depression, trauma. It can also be a way that people access creativity, access a different perspective on their lives, and can in fact build resilience that allows them not to necessarily fall into a crisis state of mental health at all. So I think this is a reason why the access to this should not be limited exclusively to the medical access route.
So, Carrie, you've been nodding your head a ton on this. Any thoughts you wanted to add? And we've got about 8 minutes remaining here, and only 4 questions. But I want to plant one seed before we ask additional questions. Then we can go to Carrie on your thoughts on this. But I want the panel to think if you have any burning questions for any of your fellow panelists, myself excluded. So, but Carrie, any thoughts on what we're just discussing?
Yeah, just kind of going back to like the wellness of healthy individuals, whatever. That's what I was kind of talking about with the diet and the physical activity, and if like this can be used to sort of perpetuate like good health behavior. And I didn't think of it in terms of preventative health, but like yes, it would be, right? Physical activity and good diet obviously will be very useful for a host of domains in life. So that's why I was nodding. I was just in agreement with that.
All right. Well, we're okay with head nods here. All right. So Taylor, you actually hit on something that was asked by one of the panelists or one of the audience members here, asking about why doesn't "quote unquote" big pharma take over hard drugs, whether it's cocaine, fentanyl, you name it. Obviously, our pharmaceutical companies really good at 1, marketing, 2, product safety in terms of the requirements they have to do with the FDA. You sort of made note that this should not be within the realm of that, or should at least be considered. So I'm wondering if you could expand on that, and I'd love to hear what else the panel has to say about that.
Yeah, there's a few things going on here. One of which is that pharma companies at any point over the last several decades could have pursued this route. They didn't, for various reasons, but probably the most obvious one is that it's going to be very difficult to make money off of these compounds because they are not patentable patentable. There are ways to make tweaks to the compounds. There are ways to potentially make tweaks to the sort of therapy that surrounds the compounds. But in general, these aren't new discoveries. These are compounds that have been around for a very long time. Many of them are naturally derived. And there isn't a huge economic incentive for major pharma companies to spend time doing research and development on a drug that they're not going to be able to have exclusivity over for that sort of patent period. That has really been one of the biggest reasons that there hasn't been a lot of progress on this through mainstream pharma. You are starting to see there is a movement in the pharmaceutical world, but it is mostly being supplemented by nonprofit interest. And so, for instance, the MDMA trials and moving that towards FDA approval, that's being held by a pharmaceutical company now called Lykos. It was spun off of MAPS, the organization that we've been talking about. But Lykos's progress through the clinical trials was primarily funded by philanthropy. And because there wasn't a strong enough economic model through our sort of capitalistic approach to make it worthwhile for a company to pursue that. So that's a big reason why we aren't seeing that sort of pharmaceutical route. It's also a reason why I frankly feel very committed to the state policy route, because it feels like one of the only ways that we are going to create broader access for these treatments.
Other thoughts on that one, or should we move on in our last 5 minutes? All right.
I'll just add
Scott,
that,
yeah.
I mean, the economics of psychedelic medicine for the really ill is a huge barrier, and we don't have a solution at this point. We are at CU Entrance Psychiatry talking to the Lykos MAPS folks about having a clinic for MDMA-assisted therapy for PTSD. It's 84 hours of clinician time for one patient, and it's, I forget, 19 visits or something like that for the patient. And so this is a huge barrier, whether it's regulated access or big pharma access.
So along the lines of clinical trials, one person just asked, how can we enroll in a clinical trial of psychedelics? So somebody has really motivated the crowd here. So how does that work?
Get your pencils out. The nationwide, it's clinicaltrials.gov. Lists all, and you can search then for all of the psilocybin trials. We also have at the CU Entrance campus a clinical trial site, and I don't know how to direct you there off the top of my head, but
You can probably Google it though, right? So
I'm sure you can. Yeah.
So, all right. Well, we'll maybe get that in the post-production here. So in the waning 3 minutes or so that we've got, I'm going to keep on the pharmaceutical line for just a second, because I really want to prioritize the questions that came from the audience. Ketamine, Elijah McClain. Is the horrific situation that happened in Aurora, where he's administered a fatal dose of ketamine. There have been criminal trials now held by holding the people who administrated that, as well as the officers accountable. But fundamentally, we still have a 23-year-old who's no longer with us for having literally done nothing. Why not do these kinds of things without pharmaceuticals? And when these things become dangerous, what are some of the things that we should look out for, be hyper-vigilant about or vigilant about, so we don't see a repeat of what happened there? And I know the state legislature just passed a bill that talks about ketamine administration and greatly diminishes the ability of law enforcement to administer it, but in a generic sense, any thoughts from the panel on that topic?
I mean, I think from just a general public standpoint, it's important to understand that ketamine in particular, it goes back to Scott's earlier comments about kind of what we define as psychedelics and how we talk about these things, and education is going to be incredibly important here. Ketamine, unlike a lot of the other more classic psychedelics that we've talked about, does have a much higher potential for abuse and potential for harm. And interestingly, it has become more accessible than pretty much any other psychedelic, and that's because it is, in fact, FDA approved for certain uses, and once it's been FDA approved for long enough, there is a certain amount of off-label use that becomes essentially accepted and allowed. And that, unfortunately, has meant that ketamine has become used in these sort of as a mental health drug in some situations without any of the surrounding therapy that we know is critical to really making it an effective medicine. And also without the sort of surrounding safeguards. And that's a separate thing from police use. I mean, that is a completely different kettle of fish, I think, when you're talking about using it as a sedative in an abusive way. But I think it's important to note that of all of these, ketamine is the only one that's actually legally available right now, and it's probably got the least amount of safeguards being built around it compared to what we're trying to do here with the therapy program in Colorado.
So ketamine, medically, ketamine is an anesthetic. If you bring your kid in with a broken bone, they're probably likely to get ketamine for anesthesia. In the Vietnam War, soldiers were given a vial of ketamine. It was called your buddy drug, and if your buddy got shot, it was a fast-acting way that anybody could anesthetize their fellow soldier. And so the psychiatric use is a very sweet spot in the dose-response relationship for ketamine. Too much is absolutely fatal, and those EMTs should damn well have known better.
Yeah, I would just say one last thing about ketamine. Several years ago when I was running this experiment, if you wanted to do psychedelic assisted therapy in the state of Colorado legally, ketamine was your only option. So to get to that paradox, even with my therapist now and all the bills that have been passed, she tells me it's still not legal for her to guide a psilocybin session with me. So there is something really paradoxical here, and there are all these companies like MindBloom and mail order companies where, technically you do like a Zoom session, but they will mail you ketamine. So there is something very strange going on here about the accessibility of one of these compounds relative to the others.
Especially given the risk profile being much
Exactly.
higher with ketamine than with the others.
Oh, so at time, everyone starts to have really great conversations. Nice work, guys. No, in all seriousness, from top to bottom here, Taylor, Scott, Nate, Carrie, thank you all so much for your insights. This has been an amazing journey. Please join me.
Thank you all for being here.
Thank you.
Thank you.
Thank you.